What does the average individual need to know about the current state of monkeypox? Given that we tend to hear, every new case that's confirmed in the United States, what do people need to know about monkeypox? What are the symptoms they have to worry about?
Monkeypox is an orthopox virus like smallpox. The good news, it is much, much less dangerous than smallpox was. But the rash of monkeypox does look like smallpox. It's interesting, if you look on the CDC's website, it says, like for the clinician, it says you can tell it's monkeypox because it looks like a fairly mild smallpox infection, like anybody's seen a mild
Oh,
smallpox these
that's
days.
right. Yeah.
But it can be fatal, but it's fatal maybe 1-2% of the time. So that's not typical. It is spread both by the respiratory route as well as by coming in contact with someone who has monkeypox, but you're not contagious unless you have symptoms. It's a pretty characteristic looking rash. You can see the rash on the website, but it doesn't look like smallpox, actually. It's just not smallpox. It's called monkeypox because in 1958, it was identified in 2 colonies of research monkeys, but it's really not a monkey virus. It's a rodent virus. So it should be called rodent pox. It was seen most commonly in Africa. Now it's obviously spread to other countries. And it also seen more commonly in men who had sex with men. And so there was a question about whether or not this was a sexually transmitted disease. If you look on the CDC's website now, it'll say that there hasn't been detected in bodily fluids like semen, but certainly any close physical contact with that lesion or those blisters will put you at risk of getting infected. But, obviously it's not just that anybody can get this virus. We'll see. I mean, there's some good news with this. There is a drug, tecovirimat, which appears to be highly effective. The way that drug works is it affects the ability of the virus to leave the cell, affecting the envelope of that virus, which surrounds the virus, so it can't really leave the cell as easily. That's good. Also, the smallpox vaccine works. For those of us who were born before 1972 who got the smallpox vaccine, it's probably about 85% effective at preventing monkeypox. But we stopped giving the smallpox vaccine routinely in this country in 1972. So you have 50 years of people who are susceptible to this virus. If this gets worse, maybe the smallpox vaccine will come back. There are 2 forms of the smallpox vaccine. One is the live attenuated version of the vaccine. It used to be made by Wyeth called Dryvax. There's also this modified Vaccinia ankara strain, which reproduces itself much less well. So there's the kind you get by scarification, which is a little more dangerous of a vaccine. And then the kind you get as a shot, which reproduces itself much, much less well. That's a much safer vaccine, which would be, I think, if there were to be a vaccine that would come into more general use if this got worse, it would be that vaccine.
Okay. How do they make that decision on starting to vaccinate people again? Is it number of cases? Is it?
Yeah, I'm sure that's right. It's just
Yeah.
how common. I'm not sure exactly what that line is. I'm sure it's a fuzzy line, but we'll see. I mean, because we went through this once before. I mean, when I was on the advisory committee for immunization practices in the early 2000s, we were on the verge of invading Iraq, and the George W. Bush administration wanted to give this vaccine to everyone. To give the smallpox vaccine to everyone. This is before we had the modified Vaccinia ankara vaccine, the scarification vaccine, which had a difficult side effect profile, to put it generously. And they talked George W. Bush down off that, vaccinating the general population. And so then it became an issue of vaccinating frontline responders, people who work in the emergency department, people who were emergency medical transport people. I actually voted against that. That didn't make sense to me. I mean, smallpox is like monkeypox. It's not that easily transmitted. I mean, you really do have to have sort of close contact, face-to-face contact. It's generally large droplet spread. There hadn't been a case of smallpox on the face of the earth since the 1970s. So it had been, decades of not having smallpox. And post-exposure vaccination does work for smallpox. So I argued against that, but I was the only one who voted against that. And it was a short-lived program. Maybe 40,000 people got vaccinated. But that vaccine virus can cause pericarditis, cause myocarditis, was associated with a couple of deaths. I think it was a bad idea. So I think you have to be careful with sort of a universal smallpox vaccine program, just because that so-called ACAM vaccine, the modified vaccine or ankara vaccine, is much safer. I'd like to think if we're going to do it, it would be with that vaccine.